and welcome. You have chosen to expand your views on health and healing. Cancer in yourself or in one of your loved ones may have brought you to this point. I'm Dr. Monica Myklebust, and I'm pleased to share with you my integrative medicine plan for optimal health and healing, specifically as it relates to the challenge of cancer. If it were just a few weird cells floating around our body, that wouldn't cause us much worry. But what really strikes fear in our heart is the idea that these cells may gather, may reproduce, and actually set up households and communities and whole cities within our bodies, using up our own energy resources for themselves, and that they might spread throughout our body, threatening our lives. In fact, we've all had cancer, or at least cancer cells growing in our bodies, whether it be from the ultraviolet radiation that hits our skin and causes damage to our DNA, or too much alcohol chronically used that can damage the cells of our esophagus, or the cells of our intestine that may have seen one too many charbroiled steaks. All these things cause cancer cells to occur in our bodies. So why don't we all have cancer? Well, it's because of the intelligence of our immune systems. Our immune systems have surveillance, identification, and destruction mechanisms that take care of the vast majority of cancer cells that arise in our system. So it's a balance between insults and defense. This balance between insult and defense is the basis for prevention of cancer and also plays a role in the treatment of cancer. We want to maximize our defenses and minimize the insults. When the body is not able to do this, cancer cells grow and divide and set up households, then communities and cities within our bodies. The aggressiveness of the invaders and the general condition of the body all contribute to the decision of how to treat this and what options are the best. So let's use my integrative medicine plan for optimal health and healing, specifically dealing with cancer, to look at how we can best approach this challenge. The first tenet is self-empowerment. And an integral life skill associated with self-empowerment is becoming chairperson of your board. Imagine that you have a boardroom and a round table. At the head of the table is where you sit. You are the chairperson of the board, and around you is your board of directors. When challenged with cancer, your board of directors might include your primary care physician, your oncologist, your massage therapist, your acupuncturist, a nutritionist, and a psychotherapist, and there may be other members of your board. These are experts and consultants who give you information and recommendations. You gather that information, take it back, and make decisions about what is best for you. That leads us to the second integral life skill under self-empowerment, and that is developing volition. This is the process of deciding what is best for me. Remember that this is your personal health journey. You'll get a lot of opinions and ideas from well-meaning people around you, but you need to decide what is best for you. After gathering information from the members of your board and other sources, you go inside using reflection and writing and other processes to decide what is best for you. The third integral life skill under self-empowerment is communicating with your body. After all, cancer is happening to your body, and you need to consult with your body. You may go inside and imagine that you're talking with your heart. You might imagine the blood flowing through your heart and your heart squeezing the blood out to your other organs. At first, this sounds a little funky or a little out there, and it may be hard for some of you to get used to. But as you practice this process of listening to and communicating with your body, you will better be able to serve its needs. It is particularly helpful to communicate with your body in the area where the cancer is residing, speaking to those cells and tissues with compassion, and also letting your body know when interventions are coming, such as placement of an IV or a catheter, and when a surgery may be in its future. The second tenet is expanded options. The first integral life skill to help with this expanded options concept is defining your health and healing needs. What needs you had years ago may be very different now that you have a cancer diagnosis. I suggest that you write down what your definition of health is at this point in your life, and you specifically list what your healing needs are. For some people, they want to get rid of cancer out of their system at all cost. For others, they may want to be pain-free or symptom-free for as long as they can. And for still another person, they may want to watch their grandchild graduate from high school. The second integral life skill is education of options. Even if you're considering only the conventional approach to the treatment of cancer, there are many options. There's surgery and radiation. Sometimes there are different chemotherapy options, as well as what are called adjunctive therapies that can help the cancer treatments to be more effective. In addition to specific treatments for the cancer itself, there are treatments that help to support the body, to keep it strong, to keep your assimilation of nutrients going so that your body is being fed through this process, to make sure that your intestines and your kidneys are working at the optimal level. There are also treatments to consider to help you with symptoms. Nausea is a very common symptom in chemotherapy, and something as simple as drinking ginger tea can help with your nausea. Friends and family can give you a foot rub with essential oils like peppermint, and it can take your nausea away while you're undergoing chemotherapy. These are all options for you, and you need to expand your education about what options are available. The third integral life skill is integration. This may be the integration of conventional and alternative therapies throughout your active treatment and continued recovery from cancer. I have outlined some examples. Additionally, acupuncture can help as an alternative therapy that can be integrated with your conventional therapies. Mind-body skills that lead to relaxation and bringing about greater rest so that your body can heal are also helpful, and there is a myriad of alternative modalities that can be combined with conventional care. Integration also refers to the integration of various aspects of who you are. For example, prioritization often needs to happen when we're going through treatment for a serious illness. And someone who is going through chemotherapy may choose to miss a chemotherapy session in order to attend a social event that is important to him or her. That would be an example of integrating different aspects of who you are in your treatment. we are in Los Angeles at this beautiful mansion on a rainy day, talking about integrative medicine. And we're now to the third tenet, which is whole person care. The first integral life skill associated with this is recognizing a healing environment. Recognizing a healing environment in a practitioner's office, maybe in the area where you receive chemotherapy, in a massage therapist's office. What does a healing environment look and feel like? You use your senses to assess whether an environment is healing or not. What does it look like? What does it sound like? Is there light? What does it smell like? Or is there lack of smell, which is sometimes a good thing? So use your senses and you should feel safe and comfortable. Of course, the most important part of a healing environment is the people in the environment. A healing environment can also apply to a place in your home, sacred space where you feel comfortable and you can relax. It might be a space that is your favorite chair by your favorite window where you can look out and see a calming view. You might listen to music there, read inspirational works, or just relax. The second integral life skill is engaging in therapeutic relationship. Specifically, this refers to relationships with professionals in the healthcare field, but can also be applied to all our relationships in life. So what do therapeutic relationships feel like? There is listening, communication through compassion. The person involved in a therapeutic relationship responds to your fears, to your hopes. These relationships are valuable in the people who care for us in the healthcare area, but also in our personal lives, particularly when we are battling a serious illness. Any relationships that are toxic or negative or abusive really need to be looked at, and preferably it's important for them to go out of our lives so that we can devote our energy to our healing. The third integral life skill is using the whole person wheel. The whole person wheel is a simple tool that is a circle with 4 quadrants. Within each quadrant is an aspect of who we are: mind, body, spirit, and emotion. This tool reminds us that we are all of these aspects, and when these parts of who we are in balance, we are in health. I encourage you to draw your whole person wheel. It may be that in your life right now you feel emotional all the time, and emotion is filling a good part of your wheel, leaving little room for spirit, body, and mind. This percentage can fluctuate on a given day or a given week, depending where you are. It's a tool to help you to remember to try and balance all of these aspects. It also helps to guide options that we may have for treatment. Under the mind, we're referring to the intellectual mind. It's important to research what our options are, to really understand what is going on within our system so that we can make the best decisions for treatment. It also refers to other aspects of our mind, such as other levels of consciousness, sometimes called non-ordinary states. These are states that are like imagination or dreaming. They're states that are used in meditation and hypnosis that can help us when we harness them to heal at another level. So within the mind, there's the intellectual mind as well as other levels of consciousness that we can harness for our health and healing. These are sometimes referred to as mind-body therapies. Going into the realm of the body, it is critical when you're challenged by cancer to be very aware of everything that goes into your body. It's important for you to read labels on your food. If you can't pronounce something, you shouldn't be putting it in your body. Because remember, everything you put into your body either has to be filtered and eliminated, or it becomes you. Yes, almost everything you put in your body becomes you. So it's very important that you are particular about what goes into your body. This is particularly relevant to the foods that we eat. And I will talk a little later about nutrition choices that best support our health and healing. Not only what we eat, but what we drink. Lots of water, perhaps green and herbal teas can all support our healing. Also, what do we breathe? Solvents, smoke, pollution, or is it fresh air? It's also important to soothe the body. Brushing of the body with a natural bristle brush can be very soothing when we're healing. It can eliminate old skin and allow new skin and circulation to surface. Bathing with essential oils may be comforting and soothing to the body, as well as different forms of body work, which may be more appropriate at certain times in our cancer treatment and less appropriate in others. Also, the communication with the body is very important, as was outlined previously. So communicating with your body, being aware of what goes into it, and also providing excellent nutrition and soothing are all important points. Looking at the spiritual aspect of who we are, this relates to purpose in life and what is the meaning of our illness. There are various ways to explore this in our own lives that may involve reading, writing, talking with a spiritual counselor. I recommend spiritual practice to everyone I see. However, each individual interprets that differently. For some, spiritual practice is walking in the woods. For others, it is sitting and meditating in a formal manner. And for others, it's participating in religious ceremony or traditions. But the spiritual aspect of who we are is critical to our healing and needs to be addressed. And lastly, we move to emotions and care of our emotions. When we or a family member becomes ill, it is a very emotional time. And I encourage you to allow the emotions to flow. Water, like we're exhibiting here with the rain, is actually the best element in nature that demonstrates flow. Emotions will flow through us as long as we allow that to happen. Emotions of fear and anger and abandonment are all very common during cancer treatment. And remember, the person with cancer is not the only one affected by it. Everyone that they know is affected by the diagnosis and needs to be involved in the process of health and healing. To facilitate the flow of emotions, journaling or writing can be very useful, as well as different forms of physical movement, like dance. By developing the integral life skills outlined here, you will enjoy a renewed sense of self-empowerment. You will understand expanded options that are available to you and experience the joy of caring for your whole person. Let's spend a little bit of time talking about nutrition and how this can enhance our health as we are challenged by cancer. I want you to remember what I'm going to say next. Nourish yourself with the nutrients you need for your body to heal and regenerate. Nourishing yourself is about nutrients, but it's also about the process of eating. We know about chewing many times so our food can actually assimilate. This becomes more important as our digestive tract can be challenged by disease. Also taking time while you eat and eating slowly. Maybe maintaining silence while you eat or having soft music playing may also help the digestion and assimilation of nutrients. The practice of grace, which many of us grew up with, may also be an important part of optimal nutrition. Medical research shows us that the key issues that contribute to the notion that nutrition can help us heal from cancer include making efforts to decrease obesity and the amount of extra weight we may be carrying, eating to decrease inflammation in our body, as inflammation is now known to contribute to cancer, and also decreasing toxins and other substances that can cause cancer, like those that are known to be on charred meats that are barbecued. We also know that increasing nutrient-dense foods in our diets can be helpful, as well as increasing antioxidants and other nutrients that help to fight off cancer and help our body to heal. And increasing the purity of our food is also important. Remember that everything you put into your body either needs to be filtered and eliminated, or it becomes part of you. So choose your nutrients carefully. A couple of key concepts include eating whole foods, eating plant-based foods more frequently than animal-based foods. Knowing where your food comes from is very important when you are challenged by a life-threatening disease in particular. So I recommend that you understand what it is that you're eating and how the animals or plants have been treated. It's also important to eat from a wide variety of foods. Fruits and vegetables are a great example, because the colors in fruits and vegetables denote their phytonutrients. Eating orange, red, green, and purple fruits and vegetables ensures you that you have an array of phytonutrients that can help your body to fight against the cancer and to also prevent infection and some of the other side effects that sometimes come with cancer. So let us just visit one more important concept before we talk about specific food groups. And this is the concept of knowing where your food comes from. As I noted, it's important to eat whole food, real food. The less processed, the better. And to understand something of the concept of where the little plant and the little animal starts. So the seed is put into the soil. Is this a genetically engineered seed? What is the soil like that it's put in? Is it given adequate water? Is it treated with pesticides or fertilizer as it grows? How does the seed become a plant that becomes food? The same thing with the animal. How is the little baby animal treated? Is the baby animal allowed to stay with its mother as would be natural? Or is it split from its mother and put in a house that has many, many other animals in tight quarters? Are the animals fed a wide variety of foods that make their flesh and their eggs and other products healthy? Or are they fed poorly, nutrient-poor foods, and so thus their flesh is not as healthy? How are the animals treated from the time they're little until they're grown? How are they slaughtered? And then how is the meat packaged and delivered to your store so that then it eventually is on your table? It's important to know where your food comes from the beginning of its life until it enters your mouth, because it's going to become part of you. Now let's talk about different categories of food. There's a whole array of food out there, and I have presented the most important general points about eating nutritionally with the challenge of cancer. First of all, let's talk about beverages. Water is the beverage of choice. I like to joke with my patients that Diet Coke is not the beverage of choice, but water. Our bodies are mostly water, and we need water to live, to flush excess things out of our system and to stay well hydrated, and to keep our kidneys functioning at the level that they need to. Organic fruits and vegetables are a very important part of the nutritional health and healing, particularly when challenged with cancer. The wide variety and rainbow of colors, such as those displayed here, ensures that you have many different phytonutrients that you are taking in to your body. Different colored pigments are associated with different phytonutrients. And so it is important to eat from as many colors as possible every day, and to have at least 10 servings a day is your goal. At certain points in our health and healing process, it may help to blend the fruits and vegetables to allow the assimilation to be easier. For instance, you can cook 3 or 4 different vegetables, then put them in a blender and make a soup in that fashion. You can also make smoothies with several fruits, some protein source, and perhaps soy milk or dairy, and drink your fruits or vegetables in that manner. I prefer this to juicing because juicing gets rid of the fiber and many of the other constituents of the fruits and vegetables. By eating organic produce, you decrease the likelihood that you are bringing pesticides and other chemicals into your body. And by choosing locally grown fruits and vegetables, you make it more likely that they have a higher nutrient content because they were picked closer to fresh time and have not been transported across the country or across the ocean. So fruits and vegetables should constitute the most of what we eat in any given day. The next category would be whole grains. I believe that if we were able to eliminate refined grains from our diet in this country, that many of our illnesses would go away. Refined grains have very little nutrient content. They would be nutrient poor, whereas whole grains are nutrient-dense foods. Whole grains could be grains themselves, breads made with whole grains, pastas. One of the keys is to look for more than 3 grams of fiber per serving on the label. This helps to ensure that this food is actually whole grain. Again, I recommend organic whole grains. Legumes we sometimes call beans, but it also can involve some types of peas and lentils. Legumes are available in all food traditions throughout the world, whether we're talking about Italian food, Mexican food, South American food, or Native American food. Legumes are a rich source of vegetarian protein and B vitamins. The next category is that of seasonings. Many people don't discuss seasonings, but seasonings have both culinary and medicinal properties. For instance, garlic and ginger are both known to have anti-inflammatory properties. Onions as well can provide quercetin, which is an antioxidant that has known medicinal benefits. Other seasonings such as rosemary or curcumin, which is in curry, can also have medicinal benefits. So I recommend that you use seasonings liberally. That brings us to healthy fats. We learned that fat was a bad thing years ago, and so many people eliminated it from their diets. But we're finding that healthy fats, such as those from plant and fish sources, are very anti-inflammatory. And as you remember, inflammation can contribute to cancer as well as other medical conditions. So ensuring that you have healthy fats from olives, olive oil, nuts, and seeds is an important part of your diet. Eggs are an example of a nearly perfect food that has gotten a bad rap. Eggs are contained in their very own container. They're inexpensive, and they're best when eaten whole. There was a trend of eating egg whites years ago, and that is foolish compared to eating the whole egg. The yolk of the egg, or the yellow, contains the fat-soluble vitamins. Eggs are an important part of our diet. Another category is dairy, and dairy is an important source of calcium. Some people are sensitive to dairy and choose not to include it in their diet. However, it can be a great source of calories and nutrients as you're going through cancer therapy. It's very important that your dairy products, as well as your eggs, be from organic sources, and that the animals have been allowed to be either free-range or grazing out of doors as much as possible, so that their flesh is as healthy as it can be. Other sources of protein include fish and seafood. In the category of fish, I recommend fish from cold waters. Fish from cold waters have a healthier fat content than fish from tropical waters. So salmon and trout and mackerel and anchovies are all better for you than fish from tropical waters. And wild fish tend to be better for you than farmed fish, although you need to pay attention to what might be in the fish regarding its mercury content and other chemicals. Another source of protein, of course, is meat and poultry, and it's fine to include this in your diet in small amounts as long as you know where it comes from and that the sources of these animals are of the highest standards. All of these foods that I've outlined have healing benefits. So include all of these healing foods in your diet. And don't forget about grace before meals and gratitude around your food, as well as being mindful when you're eating. And remember that food is medicine, and to nourish yourself with the nutrients you need to heal your body.